Okay, go ahead, Kim. Kim, you look frozen.
Okay. Are you folks able to hear me okay?
Yes.
Okay. Give me just a moment here. I left my, fortunately, I left my documents upstairs, so I need to toggle back and forth between my screens here for just a second. Give me just a moment and then we can get started officially. Okay. Sorry, half a second here again. Okay. Sorry about that. Sorry for that delay, folks. All right. So I'm Kim Taylor. I know there's a bunch of us here, so let's go ahead and get started. Welcome to the March Behavioral Health Advisory Board meeting of Spokane County. So let me go ahead and do roll call. So again, I'm Kim and I am here. Andrew? Andrew around?
Present.
I'm not, Andrew, I am seeing you on my screen as being here. So if you could unmute yourself to let us know or give us a hand signal via chat, that would be great.
He did, Kim.
Yes, sorry.
He said present a minute ago, Kim.
Okay. Oh, thank you, Shane. I could not hear him.
Sorry, having some difficulties there. I'm here.
Okay. How about, let's see. James Myers? I do not see James, so we're going to assume no. How about, sorry, again, I have to keep going back and forth here. I apologize. How about Gail?
Yes, I'm here.
Perfect. How about Jill?
Here.
Perfect. Chris? From the
Present.
Sheriff's Department? Perfect. Beautiful. Lori Moon? Lori? Okay. How about Lita? How about Mark? Oh, sounds like Lita was excused. Sorry about that. Mark?
I'm present.
Perfect. Dr. Limburger?
Yep, I'm present.
Perfect. Shane, I know you were here. Michael?
Present.
Yeah. Are there any other folks from, say, Community Affairs, Kat? Jessica? Justin? Katie?
Yeah, good
Perfect.
afternoon, everyone. Justin here.
Perfect. How about Katie? Michelle? Nancy, I know you're here, I believe, right? Tom is here.
Yeah, here.
Perfect. Any other folks who are here that I have not called? And if I have not called you, I apologize. Any other folks that are present that would like to introduce themselves?
Hi, this is Liz from CHPW.
Thank you, Liz. Appreciate it.
Hi, Liz.
Any
Hello.
other folks? Okay, well, let's go ahead then and get started. So if you folks could take a look at the meeting minutes that were on the back of the kind of attendance roster, that would be great. After you've had a moment to review them, if I could have a motion to approve and then a second, that would be greatly appreciated.
Motion to approve minutes.
Thank you. Was that Shane? Michael?
Yep,
Okay.
yep.
Second,
Do I have a second?
second,
Andrew, thank you. All right. Those are approved and seconded. I'm not hearing any need for revisions. Are there any or corrections?
None.
Okay, perfect. All right, let's move on to our presentation. It sounds like we have a guest, Mr. Palmer from Excelsior, who's going to talk with us about the Teen Text Line update.
Well, good afternoon, all. Hopefully you are all enjoying this like fall/springish day because you know what we're going to get today. But anyways, just want to give you guys a little update. Want to keep it very simple. So we have definitely attacked the community in the most positive way. I'm going to put it that way. So we provided a calendar each month. The last couple of weeks, we've gone to Shadow Park High School, Rogers, both community centers, the MLK Center, the SYSA, Youth Sports Association, YMCA Warehouse, and the Hub, to start engaging with those businesses to educate, the youth of the service that we're providing. But also being able to give peer support services to the parents and letting them know that, this line is accessible for them as well. For the month of February, we've had an uptick in calls. I think we've received the most calls in the month of February this year than we have in the past year, so that's a plus. We're just really focusing on connecting with these partnerships and educating the people about the line and being more intentional. So with our engagement calendar, we are just making sure we touch bases with all of those businesses once a week. So we can be intentional about the relationship that we're trying to establish, focusing on the quality of the line versus the quantity of, businesses or places that we're able to make contact with and kind of slowing it down a little bit. We finally got all of our rain tree information. All that data has been entered, so we're all good there. We have a system developed where we'll be entering that information bi-weekly. So thank you guys to your team that helped out in that process for sure. And really that's really it. I just want to open the floor to any questions you guys might have. And I'll be more than happy to answer those.
Demetrius, this is Kim. Are you noticing any, tell me if this is correct. The Teen Text Line was really developed as a means of sort of peer support. It was not really intended to be used in an immediate crisis, for which, in that case, it'd be better to call regional crisis line. But that said, number one, is that accurate? Number two, do you have just approximate numbers or anything that you can tell us or any patterns that you're noticing among folks that are calling, whether that be a particular age demographic, a particular concern, particular time of day? I know you said February tended to be the hot month for whatever reason, and I don't know if that's just more advertising or what that is, but just any thoughts or observations that you can share with us?
Yeah, so it's definitely pushed more towards as a peer support, just kind of support line for just kind of general support, any youth who might just need someone to talk to. We haven't really had any escalated calls or emergent calls. They seem to be pretty simple. We are seeing some repetitive calls that are happening with the same people. So some of the engagement specialists are kind of aware of the situation. Nothing out of hand, that's for sure. As far as calls, tends to be slow during the morning. Most calls are coming in between that 3:30 to the 7 p.m. time. One of the things that so next week I have a meeting with a resource officer he's a director of resource officers for District 81. So we're trying to see if there's a way that youth can gain access during their school time, depending on, if they reach out to their counselors and they might need some time. That might be an option for them as well. So that's where we're going there. As far as the age demographics, we're looking at more of that 13 to 16 age range, which is pretty sustainable there. So it seems like it's well versed and covered there for sure.
Thank you. Appreciate that.
Yeah, of course.
I'm a little curious about actual numbers. Can you give us some numbers, like, for example, for the month of February in terms of calls that you received?
Yes, hold on one second here. Pull this up on my laptop. I wonder if it's able to pull up here. I think it's being recorded. Won't allow me to pull it up here. Hold on one second. No, log into my other. So as I'm gathering this information, does anyone else have any questions?
I have another question related. You mentioned interfacing with businesses. Can you kind of explain a little bit about what that's all about?
So the businesses that I'm pertaining to is more so like the warehouse and the hub. They're both sports complexes, but they just host a lot of youth practices, sports practices, and things like that. So that's what I mean as far as businesses. They're not necessarily an association, just a place that's rented out on a weekly basis.
Demetrius, can I ask you a couple questions? What challenges are you guys seeing? I'm totally for your program, and I think we've been needing this for a long time. Okay. What challenges are you guys seeing, and where can we help you guys?
So I think in the past, the challenge was really, being not saying that we weren't intentional about the outreach, but you can't just, make a stop, drop off some materials, and then go on to the next. I think being able to slow it down and really educate people on what the line is and establishing those relationships. So, we have 4 engagement specialists who go out just to educate people on the line, and it's a familiar face that they're seeing. So they're more likely to engage in the line versus it just being a one-time deal. Really, that's really it. I don't really think we've had too many barriers. I just took over this line myself personally, really in January. So we've been really focused on just making sure that we're intentional with each engagement in the places that we go to. So not to sound cliche, but we're not really experiencing any barriers right now.
Okay. So the reason I'm asking you is because I talked to the people when they first started this program at Excelsior, and I don't know if you've built a relationship with Terry Austin. She ran the Widify program here in Eastern Washington, and she was hugely successful with building relationships and working with the resource officers.
Mm-hmm.
And she's with GSAC, and you may be able. She worked with us here at the board years ago, but you may want to talk to her because she has a lot of ins and relationships with people, kind of like Gail over there. And then my other question is, you're talking to the resource officers. How about educating the officers in the high demand and the high call areas? And I hate to say this, but in the poverty areas tend to be our bigger issues. So how about having a resource for the officers when they're engaging with the teenagers and educating them on the process so that they have a resource? Because I mean, we've just got them out in the field with very little resources, in my opinion. So,
right. So, so I'm not sure if you're really familiar with those that are in that field, but Ed Richardson, who's pretty well known in the community, he works for SPD as well. So actually, we were able to connect a long time ago. So he actually has a stack of cards that he can pass out. He's been referring people to the line. But being intentional, as you were saying, as far as those low income areas, we've been responding and going out to Rogers, Shadle, and NC.
Yeah.
So really being intentional there. And then the community centers tend to be the same way. I think, last week we went to the MLK Center and we were able to come in contact with about 60 youth during their after school time. So yeah, we're definitely hitting up those areas for sure.
I think it's fantastic what you guys are doing, and thank you.
Yeah, no, of course. Back to you, Rose. For some reason on my these numbers are on my laptop and they're stored, but since I'm on Zoom, it will not allow me to go back. So I can, if there's a chat, I do have a report that I can share. I can drop it in here after I'm done, if that works for you.
Yeah, I would very much like to see that.
Okay, no, I'll definitely take care of that for sure.
And Demetrius, as a reminder, teens can certainly text, they can call, or is it correct, they can video chat as well?
Right now we're just doing it's just the chat aspect. So just via text.
Okay, got it.
Demetrius, you said that you're receiving calls from 13 to 16-year-olds primarily, and I appreciate your focus on the high schools, but is there any plan to reach out to the middle schools as well?
Yeah, so we have in 2 weeks, I have a meeting with Salt Middle School, which is right down the street from Excelsior, and then Northwood Middle School as well. So we'll be touching bases with those for sure, with the middle school group. It's just a matter
I think that you'd really get a response out of them.
Yeah, no, I agree with you for sure. So, and then just kind of a resource through myself. A little bit of my background is that outside of Excelsior, I work with over 200 youth. I'm a trainer, but I also own a semi-pro football team called the Spokane Wolfpack. And all of our guys are responsible for 15 hours of community service. And we have a 45-man roster. So during our games, we actually have a community scrimmage that's coming up soon. So I have a few guys that'll be out. They're aware of the line, so they'll be out educating. We have 10 of those guys are actually certified peer supports as well. So that'll be another tactic that we'll utilize this year. But so I said, there's so many places to really connect with. That's why I see this program really growing and the numbers kind of skyrocketing. And as they said, it's just strategically planning to make sure that we are hitting up every demographic and age group. And that's definitely the plan. So,
Nancy, I don't know about what to do with this drop file that he's going to send us, but could you email that to us or somehow make sure we have access?
If you'll just email it, I will distribute it to the whole group, please.
Okay. Yep. I'll email it to you.
Okay, terrific. Thank you.
Thank you.
And Demetrius, if you just send it to Nancy, we'll make sure that gets distributed to the group.
To Nancy. Okay.
Yeah.
How you doing, Justin?
It's good to see you, man.
See you too. It's been a while.
Yeah, I know. We gotta get back together.
Yeah, we do.
Busy, for sure.
Exactly.
Demetrius, thank you so much for being here. Folks,
Yeah,
are there any other questions for Demetrius? Or any other questions about Excelsior's team text line at all that we should address before we, and Demetrius, you're certainly welcome to stay if you wish, but if you have other things to do, we won't take it personally. Sounds like you have one or two things on your plate. So
yeah, just one or two, no big deal.
Yeah.
But no, I'll send the email and then we send an engagement calendar every month. So if anyone is interested in joining us out, please just reach out, let me know. We have some team text line t-shirts that we're getting ready to make. So you might get one if you participate. So
beautiful.
Demetrius,
yes, sir.
You got any plans right now for doing outreach to kids who are still doing online school? I see that a lot of kids in the districts around Spokane there's a lot of them that are doing online programs for the districts, and I'm finding in the court that a lot of those kids are kids who have acute mental health issues, like they have a problem with bullying at school, and so what the school district does is they shuffle them off to homeschool. through the district. And so we've got a lot of kids that are experiencing mental health issues who I'm afraid post-COVID are going to fall through the gaps because no one sees them in person because they're at home all day.
Oh, that is a great point. Yeah, as we establish the relationships with District 81 in particularly, it's a little hard to kind of get into that door, but I have a lot of connections within there. So that's definitely a topic I'll bring up to see if we can gain access to those youth as well. Thanks for the recommendation.
Demetrius, hi, it's Nancy. I just wanted to ask, does Excelsior have the teen text line posted on your website?
So yes, so we are currently we have a deadline of Wednesday. We're actually remodifying our entire website will look different, and the teen text line link will be on there.
Great, because we have the phone number that we are linking to if people go to our ASO webpage. And so certainly we could also link your website if you think of letting me know when that's available and providing me the URL, then we can make that update to our webpage.
Yep. So Nancy, yep, URL, I'll send you that, and then I'll also send you that report as well. Cool.
Great, thank you.
Yeah, no, thank you. Thank you guys for having me.
Any last comments or last questions for Demetrius? Okay, Demetrius, thank you so much for being here. I appreciate it.
Yeah, thank you.
Look forward to getting your information.
All right, send over now. Yeah,
all right. Thank you.
Mhm.
All right, let's see. Looking at the agenda, let's move on to the Ombuds report. Gail.
Unmute. Okay. I'm having difficulty with my finding the document. Oh, I wanted to share. Never mind. Now that I see it, for some reason it had disappeared. So Nancy, if you let me share my screen, I'm going to give this a shot.
Yep, you're able to do that.
Okay. Is that visible to everybody?
Yeah.
Yes.
Good. So I just want to preface this with saying that as of October 1st, last year when we went live and online, we also had to have in place a database that was still being kind of tested out. I mean, it had been beta tested, but we've been putting so much more need into it to be able to pull reports from that they're revamping how we can get reports. And so that's why I don't really have anything good. I just have some, like my graphs that I usually have. But I just wanted to do a one-page overview. I was able to pull some numbers for you, and that's at the bottom of this. And then Nancy will probably send this out with the with everything else that goes, or she'll send it out after this meeting. I meant to have it earlier or late last week, but that didn't happen for me, unfortunately. So I just wanted to say that, it's been quite a process. It's been exciting to see the growth. It's been exciting to see how all of our 10 regions are now interacting together in a way that never happened before. And, I think that that's one of the great benefits of what we've done. I'm still doing 2 jobs. I'm still doing the behavioral health advocate job for our region. And I'm also program director for the east side of the state. And so it's a little hard to juggle all of that at sometimes. But I wanted to just plug again our forum. And Kim, thank you for attending the last one. Every forum, I learn a bunch from.
Yeah, it was really useful. I appreciated it.
Thank you for that feedback. Yeah, it's hard to, I think we're getting more people attending, and I try to let the group lead what we want to do, but I really liked, I think, a suggestion, maybe came from you, was have an agenda ahead of time. I haven't had that, so I'm going to start adding that agenda, and also maybe a speaker. Some of the other regions are adding a speaker at a point in time, so that way there's some information that can be shared and people can attend and know if it's something they want to attend. These are things that are all still taking shape as we grow and learn. And that's the second Wednesday of every month. I think I've sent that information out for the link.
Yeah.
anybody would like the meeting invite, just send me an email and I will be happy to forward that to you. One of the other things that I've talked about before is that that we can provide these services to anyone, no matter their insurance, if that's Medicaid, Medicare, commercial, no insurance. And maybe that's part of why we're growing, but also we're getting so many calls, and it's just been amazing to me how many calls we've had. And they're not always that easy to capture. But so I'm pretty here, I'm talking about the universal database that we're using. The other part of it is that Pure Washington expanded programs, and we're all using the same database. So they're going to break out ours so that it's more flexible and can give us what we need. And so I went just back in and I went to our database, and I just found just from that were open as of January 1st, that meant they could have been open in December, but they were open. And there were a total of 90, and that includes information and referral as well. But there were 15 complaints. Now, complaints, you've always heard me talk about grievances. These are the same thing. Grievances now grievances are, in our new world, in my new world, is anything that goes to the payer, the funder and above. So that would be anything that went to, say, the ASO, anything that went to Molina, CHPW, or coordinated care, any of those places, and that becomes a grievance. And so I'm happy to only have complaints. So this has only been for 3 months, and it seems like that's not very many, but and I know that there's more. I believe there's just probably a good 20 that I'm working with, but I wasn't able to, again, access all the data that I needed to in the time that I needed to. So, and I'd like to say too, that the information and resources, the referrals that we do, some of those can be very time consuming. They can take hours, and maybe we won't have an answer for that person for a couple of days. We try to be no wrong door. And if we don't know the answer, we will try to find a place to refer them to. We get a variety of calls, comes from every walk of life. We get a lot of calls that probably should go to long-term care, or that they just don't know who else to talk to. They don't know where else to go to. And you know, some of the stories that people are calling us aren't very easy to listen to, but you know, at least we know that we were able to provide that handoff to where they needed to go. So as I say in the bottom of this, the above numbers could change once the new reporting format's put into place. So I really look forward to being able to provide those in the same visual effects, and so to speak, or the same way that I have in the past. But at least this gives something that we're looking at. So does anybody have any questions? Nope. That's unusual for this group. Whoops, get away from
No
there.
question for me, but this is Kim. I was a little late in logging into the last, to the call earlier this month, but it was nice to see, actually, there was a good variety of folks from, you know, some sort of professional folks in the community, certainly some consumers in the community. So it was nice to see a good discussion of people.
Yeah, I thought so too. I really did. And I think some of the things that were talked about was, you know, of course, what can you access if you're in a more rural environment? How easy or hard is it to get to an appointment? And depending on what kind of transportation there is. Even though within the Spokane metro area itself, we have a bus service, but if you live further out, you just really have a hard time getting around. I think that was one thing that sticks out to me. Anything about that you remember, Kim?
Yeah, I just remember, excuse me, I remember that in the chat function, there were a lot of people that were sharing resources that I particularly appreciated. But yeah, a lot of the concerns were about rural areas for sure.
Yeah, and I think too, there was one gal that talked about aftercare for youth.
Yeah.
Once you have discharged, you know, what kind of services are available to you after that? I think she used that phrase a lot. who checks in with them, or how, where can they be able to find those supportive services? So hopefully we'll be able to provide more resources for folks out into the future. And if you're interested, just please join me. I think the next one is April 12th, the second Wednesday, from 3 to 4:30. And unless people have questions, I don't have anything else.
Any questions for Gail or comments? Folks, if you do have a chance to attend one of the next ones, I think you'd find it really beneficial. So please do. Okay, thank you, Gail.
Thank you,
Appreciate
Kim.
it. Yeah. Let's go ahead and move on to administrative updates. Jessica, we will start with you.
Wonderful, thank you. So I am here today to give you all a quick update on some of the programs that we have going on here at the BHASO. I'm going to start with some of our ongoing projects, and then I'll briefly talk about some of our future projects that are in the works. Most of these programs have been stuff that we've talked to you about before, so this is just going to be an update based upon the things that you've heard before. The first program I'd like to share with you is the Initiative for Student Wellness. This is something that I'm sure has been presented to you guys a couple different times regarding our the program that we have within the schools. So far, we have screened about 224 students in the West Valley School District through this program, and are in the process of onboarding 2 additional schools. So right now, like I said, it's in the West Valley School District, and we are onboarding Riverside and Freeman. So really excited to keep continuing this program and screening more kiddos and getting them the services that they need. The next program is the Housing Outreach and Stabilization and Transition Program, the HOST program, which I'm sure you've also heard of. This is operational through Frontier Behavioral Health. They recently have hired 6 staff. They have a nurse, a mental health professional, a peer support specialist, a clinical supervisor, an outreach and engagement specialist, and an advanced registered nurse practitioner. They are currently working to hire a substance use disorder professional. And they're providing outreach and engagement to multiple agencies, providing education on the program. However, they haven't started actual services yet because they're still in these beginning phases, working through internal policies and procedures.
And just as a note to that, we also had the unique opportunity to be able to ask for additional funding. Well, they had additional funding and I just said, let's use it. So we put a request in. We're hoping to get an off-cycle amendment to allow for additional funding. The hope there is to purchase transportation vehicles to be able to take individuals to and from wherever they need to in the community. Treatment, resources, or just do outreach and engagement. So a lot of great opportunities there. I want to capitalize on that and purchase that for our region because other regions didn't have that availability. However, we won't get a final say on that until they finalize the contract. So I don't know if it's going to be July 1st or an off cycle, but we did put a request in and look to be received well, just not any final determination yet.
Thank you, Justin. We're super excited about that opportunity. I'll move on to one of our other programs, the Recovery Navigator program. It's operational in all of our 6 counties and it's going really well. We're really excited about everything we're hearing about this program and the individuals that have been served. In 2022, the Recovery Navigator program received 914 referrals and enrolled 134 individuals in case management. It's very exciting. It's up and running and doing really well and helping a lot of individuals in our region. We have the teen text line. You already heard all about that today, so I'm not going to go into any more detail regarding that one, but we are excited about that. We also have implemented the Children, Youth, and Family Mobile Crisis Teams, which are operational in all 6 counties that provide crisis services specific to youth and families. And we're currently working on the Mobile Response and Stabilization Services Program, MRSS. We're currently working with Frontier and the Healthcare Authority to finalize some payment mechanisms and team structures, but Frontier's in the process of hiring for this. This is another child and family youth focused program. So those are kind of some of the ongoing programs that we have going on. Is there any questions about any of those before I move on to what we're going to be working on in the future?
Can you remind us or maybe remind me specifically who sort of the lead agency for the Recovery Navigator?
So we are kind of the lead agency, but we have the Recovery Navigator program in a different provider in each of our 6 counties operates that. So we have Frontier Behavioral Health, Pend Oreille County Counseling Services,
Got it.
Northeast Washington Alliance, and then Adams County Integrated Healthcare Services. Or
Got
I mean,
it, okay.
in our region, it's actually Pioneer Human Services. I apologize.
Oh, okay, got it. Thank you.
I think what you've done out there in West Valley is a great thing, Jessica, and I'm really happy to hear that you guys have plans to move into Riverside and Freeman. Those are areas that really need your attention. Are there any plans for Central Valley and East Valley?
That is a great question. So I have plans to put it in every school. If I had the money, I'd do it tomorrow. Challenge is workforce and funding. So we are working with our commissioners on target schools that they want to put it into. Riverside and Freeman were noted because of the size and the need. There was a lack of available resources. We are anticipating the next school probably to receive that investment is Cheney, also because of the size and need. And then afterwards, and this is always what happens, we have our idea about what we want, but the commissioners direct and generally lead on where the implementation is. So yes, do I want Central Valley, East Valley? Probably East Valley first before Central Valley because of the total size of the school districts. However, at this stage in the game, we are not wanting to bite off more than we can chew. So I think that's really important, and taking on ensuring the program success for the implementation sites and then moving on to the next one is more important than getting more schools at once. So once we get Riverside and Freeman up and running, probably at Cheney, and then we'll look at next sites all within this next year. So we're very excited about that expansion, but we also don't want to leave West Valley without the resources it needs. So a lot of work on the table. I need more people because I'm pulling all of my staff to do all these projects. But it is an amazing, exciting project. It's one of the few things in my entire career that I really get excited about because of what we're doing and the implications for youth and addressing the youth crisis. Really, if we want to be clear, we've been saying about this for how many years? You guys have had to listen to me talk ad nauseum about this. But if there was anyone to address the youth mental health crisis, the county needs to lead. And we finally are doing something where we can lead, take point. We can say, regardless of your insurance, your ability to pay, we're going to treat you. That to me is amazing. So we've removed any sort of barrier. We have the equity and access. This is amazing. So yes, we have a lot of plans for the future here. In fact, we just met with the Valley, Spokane Valley, the city of Spokane Valley, to really look at how can they invest. They're really excited about this. They want us at Central Valley, and they also are in talks about could they provide additional funding to support that alongside that. So a lot of things in the works. Exciting.
Yes, definitely one of our favorite programs to work on here. We get very excited. Any other questions about the ongoing projects that I discussed? Hearing some silence. Just going to quickly go over some future programs that we have in the works. As we already talked about, the expansion of the Initiative for Student Wellness, expanding to possibly the Cheney district and beyond. Also, maybe talking about adding more clinicians to the existing projects due to the capacity and the need that we're finding. In addition to that, we will be starting what's called the Youth and Patient Navigator program in July. That's a task force of local behavioral health resource providers that come together and assist youth and families that are discharging from inpatient services, and helps them get connected with necessary resources to help ensure their success in the community. And like I said, we'll be getting this project July 1st of 2023. We are also working on peer respite. We are partnering with Passages Family to Support to help in standing up a peer respite house. It'll be the first one in Eastern Washington. It will provide voluntary short-term, overnight services in a home-like setting that is staffed by peer support specialists. This provides a safe space for individuals and helps divert them from the need for crisis services, hospitalization, and just promotes overall wellness.
That's really cool.
Yeah, we're very excited about this one too. And then the last one I'm going to mention is the Behavioral Health Transitional Support Pilot Project. It's a mouthful, BHTSP for short. In this program, we are partnering with local transitional shelters to provide on-site behavioral health treatment services to those that are utilizing those shelters. It'll aim to assist individuals who are experiencing homelessness and accessing necessary behavioral health services, providing linkage to resources to prevent further deterioration and assistance in regaining housing. So we're very busy here at the ASO. Justin's keeping us on our toes with new projects, but we're really excited about all the good that I feel like we're doing in the community. You guys have any questions about future programs that we're working on?
Those are
Can you back
phenomenal.
up?
Thank you.
I was gonna say, can you back up? There was one that you talked about prior to the getting somebody into the shelters. Which one was that before? The BH?
Peer
that's-
respite.
Oh, peer respite, thank you. The peer respite one, thank you for that one. When is that one going to be opening? I haven't been up there, but I hear they're building there.
That's
Yeah,
a,
I believe that. Oh, I'll let Justin take that.
yeah, that's a great question, Gail. So the state anticipates in conjunction with passages, it'll be sometime in the summer. I think the reality is more complicated, right, for the facility to be approved. Initially, the funding that was provided was going to go through us, but we actually advocated for it to go directly to provider because they would have gotten a greater outcome, a greater amount of the funding all at once. But we are also going to be joining in participation of that. We firmly believe in that. I think the board has made, Behavioral Health Advisory Board has made it clear, peer and peer engaged services are where the need is. So we're going to bring that online first. So I hope this summer, Gail, as long as the builders can get it done and then get the building ready. That's really the issue right now.
And
That
the
would be
peer
awesome.
respite. Sorry, Gail, go ahead.
I was just going to say that would be awesome.
Yeah.
Gail, I remember when we were hearing about this when we were both ombuds and how excited we were.
Right?
It's coming to fruition. It's
Yeah,
very exciting.
finally, yes.
What the peer respite, is that intended for youth or adults or both, or and then what general area of town is that intended to be built?
It's intended for adults and it's going to be near their other facility. Jessica, do you remember where that's at location wise?
I know where their facility is, but I don't remember where the peer respite house actually is, but I can definitely get that information and email it out to the group.
Yeah. It's going to be in the Spokane City area.
Yeah.
And the goal there is peer-led walk-in or peer-led engagement. So the goal is individuals will determine if the need is there, 18 and above.
Yep.
Got it. Thank you. Any other questions for Jessica? Or Jessica, I certainly don't mean to cut you off.
Oh, no, I was going to ask the same question as you,
Okay.
Kim, so perfect.
Okay, sounds like not. So let's go ahead and move on to Justin. It looks like some upcoming projects as well as a discussion on board meeting frequency.
Yes, and Jessica was able to cover most of the upcoming projects. There's only one I would add to that is NAMI reached out to us and expressed a desire. They have a program that is potentially going to be losing their funding. So they asked if we'd be able to support that. We had expressed a firm desire to want to engage with NAMI and really look at the continuum of care for preventative services. So we also believe we'll be supporting that project in the near future as well. They have a navigator that supports families and families engagement with awareness for mental health and also just mental health first aid. That's imperative, not only for families, but for individuals that are wanting to have support for engagement while their loved one or family member is in treatment. So that's an area we wanted to support heavily. So that's another one we'll probably be looking to support here in the near future. Again, heavily supported by the BHAB, not only in the past, but present, asking us to really look at how can we support families and that engagement. So really are investing heavily in that area. And then one other one I would probably add to that is the desire for us to expand in the opioid abatement dollars. So the county will be receiving opioid dollars from the settlement agreements. County is looking at hitting a couple of key areas, but really needs to figure out how they're administratively going to put that out there. They have tasked myself and my team with giving them feedback on where are the key areas. So opioid dollars are part of the settlement dollars, which are not limited to certain funding restrictions that we would have with non-Medicaid or Medicaid. It is supposed to be directly towards very key areas with opiate treatment, but it doesn't limit it to, you know, it can't be supplanted or can't be used for this group or can't be used with individuals with this eligibility. Essentially, it's pretty free in that area. So I've advised the board, if we go down this road, to really look at areas where current funding does not cover. So we don't, in my view, just double down on current things, but look at hitting gap areas. Two areas that I'm recommending the board initially are law enforcement diversion. So really working on training law enforcement to engage with individuals who may be involved with substance use and or mental health issues and diverting them so they don't go to jail. We really need to look at diversionary efforts. That's one area that we're really recommending. And the second one is perinatal and obstetrics. We're looking at individuals who are currently in the maybe the throes of addiction or currently utilizing substances. Could be opiates, it could be any substance, but also have will be in the future parents and or pregnant. And we're really looking at the long-term effects of individuals who are who bring children into the world, but also have involved in substances. So the impact of that in a neonatal and or geriatric sense. So how can we educate doctors, be more responsive to, and we're not just talking about doctors, but even nurse practitioners, you know, which are now doctors now, right? DNPs, doctors and nurse practitioners, to really look at how can they engage with families to identify, provide support, and then be engaging with them, even if they are using, and then after the baby is born, to provide support. So even if they are and are born with the potentiality of having substance use involvement, how do we give them the support they need? So those are key areas that I think are really helpful or supportive. I'm advocating the board at this point to really look at. So that's coming up in the future. More to come on that because the board still has to decide once they accept the money. It's not a lot in one lump sum annually, but it is over 17 years. So there is a longevity of the funds that could support some really great involvement. I've had preliminary conversations with regional hospitals and geriatric facilities to really look at, not geriatric facilities, my apologies, gynecological facilities, to really look at the obstetrics and gynecology and how they can support those individuals and families and youth and children where they can do the best outcomes long-term. So I'll pause there. There's a lot of information before I move on to the next topic.
Thank you. Those are great ideas. Any questions for Justin?
All right. Since there are none on those, I'll move on to the next one, which is just an administrative one on the board frequency. So when we initiated the board's look at the charter and really the bylaws, how often we wanted to meet, we wanted to reduce the burden on the voluntary members who are part of the BHAB to look at a certain amount of times that were required, but not make it so frequent that it overburdened them. Since that time, the board has chosen to meet more regularly. There's been a lot of topics. So we wanted to bring this forward back to the board to say the initial bylaws allows for us to meet quarterly. Do we want to move back to a quarterly meeting structure to allow for, you know, less time on the board, to allow for more agenda topics to be brought forward, and then allow again for ad hoc topics? That guides us as the administrators of the meetings to better prepare in advance and notify the board. We don't want to step outside of our bounds here. So we want to make sure that we set meeting schedules that the board would like to meet. But our recommendation is, if we get through this legislative session, to go back to a quarterly meeting schedule to really allow for topics to be cohesive, allow for the time being spent to address key issues, and then allow the board to dictate when and if they want to meet outside of that schedule. So I'll turn this back over to Kim and the board members for feedback.
Got it. Thank you, Justin. Folks, I have some thoughts on this, but I'd like to hear from other folks first. What are you folks thinking?
I'll speak out. It's Gail. I new board member, but have been very familiar with meeting with the board. And it was struck me to think that every 3 months, I mean, there's all these new things that are going on. How to stay on top of what is actually being done in our community. To me, only meeting like 4 times a year isn't enough time to be able to understand all of the things that we're doing and be able to provide the guidance that might be needed. That's just my thought. I mean, the every other month one, it seems to work. And like Justin said, maybe just through this legislation, and then they recommend going to quarterly. I think that might be too infrequent, but that's just me.
Thank you, Gail. Other folks?
Yeah, I actually agree that we probably should be meeting more often than quarterly, just because, you know, you start drifting away from what was important and what did we do last time. And if we were to go to every 3 months, it would be nice to have some sort of an update sent out to the board members so that we kind of still have a handle on what's been going on. But it's certainly not a burden at all to me to meet every 2 months. And it's Dr. Limburger speaking.
Yeah, thank you, Dr. Limburger.
I think it's a matter of need, and 4 times a year versus 6 times a year doesn't seem like it's that big of a deal. And certainly 6 times a year I don't consider to be burdensome.
I can start going down the list. Other folks?
As a new board member, it's been actually sort of helpful to have the meetings a little more frequently, so I can become a little more adept at the topics we're talking about, discussing. So I'm fine with a bi-monthly type setup to continue.
Okay. Thank you.
I'm fine with that as well. I think the more we meet, the more educated we can get on what we're trying to do here.
Okay, thank you.
Yeah, I also agree with our current meeting schedule, if not meeting more often at the busy time of the year in the spring when things are really kicking off. And Justin's such a mover and shaker. I think every 3 months we'd just be buried behind and we wouldn't be able to keep up to date with things at all.
Mm-hmm.
And I think the engagement and the being involved is a big part of this. Not just showing up at these meetings, but actually being able to get involved with some of these issues out in the community.
Thank you. Tom, any comments from you or other folks?
No comments from me. Seems okay as it is.
Okay. My thoughts are similar. I would personally be okay. I mean, I'm fine with every 2nd month. I'd be okay with quarterly, but the caveat I was going to give, and this is similar to the feedback of other folks. If there was a means in between that 3-month period of either receiving updates, kind of updates on sort of what came about from last meeting, like in writing, or a way that we could, for example, if there are other events going on in the community that sort of connect to what we're doing here, if there was a means that the board could be informed of some of those events, whether that be, say, what Tom's group is often involved with every year, some of the walks, whether that be certainly Gail's monthly forum, whether that be other events, whether, open houses, whatever. I would like the opportunity to know more about those, to engage in those, but I'm good with every 2 months or every 3 months, with the caveat that we have updates in between. So Justin and other folks, based on the fact that you kind of heard from us on this, what are your thoughts?
It's entirely up to the board. We would always make this available. So what we can do is continue the existing every 2 months schedule. And then the board can make the determination if they would want to meet in greater frequency or to skip the next meeting. I would defer to the determination on the board. So we can send an update to that effect. The reality is during the spring and the summer, we do the legislative session, which has a lot of different things. And then the summer always has the block grant reports that have to be updated and the board has to approve. So really the off months are Christmas and fall, where we're just attempting to implement the programs the board has already approved. So oftentimes we skip the December one because people are busy, recognizing that we meet both in November and October. So we'll just continue the schedule and let the board to decide if they want to cancel or not and then update in the meantime. That's entirely sufficient for us.
Okay. Without having, I hate to ask this because it adds more work, most likely probably to Nancy, but would there be a way that potentially maybe 2 weeks ahead of the scheduled board meeting, if there was some sort of poll or something that would include obviously county folks, meaning are there any updates or there's not going to be a whole lot of updates at the next meeting? Do you guys want to continue or skip? Would there be a way that could be sort of incorporated? And again, with that, I hate to add a lot of extra work for someone else.
Well, Kim, our experience is when we do that, oftentimes we don't get the feedback, and unless we get a quorum, we cannot make a unilateral decision not to meet. So we just have to meet anyways. We'll schedule it for the board. And that's the unfortunate bit. The board is the only one that can decide based on the quorum if they don't. So what we can do is, so we will always defer to that. So I would recommend, and Nancy, you can speak up here, that we continue to have a bi-monthly meeting. The board can choose at those meetings whether or not to skip the remainder meeting, or we can present to the board that additional meetings are needed in those off months, and they can decide yay or nay. Would that be acceptable?
I think that seems reasonable. Okay. Any additional discussion or comments about the frequency of the board meeting, frequency of board meetings? So again, it sounds like we've decided at present that we will meet every 2 months as we have been. So our next meeting is going to be in May. I don't have a calendar in front of me, so I'm not sure of the exact date, but essentially be the regular schedule that we already have.
22nd.
Okay. All right. Justin or Jessica, anything else from the county or Nancy?
No, not unless anyone has any questions. We're good.
No, nothing.
Okay, let's go ahead and move on. Tom, Consumer Consultation Panel.
I have here the CCP minutes from January and February. First, I'll do January. At this meeting, our guests were Kaylin Roy, a liaison to the BHASO and the CCP, and Gail Kogel of the Office of Behavioral Health Advocacy. Brent Smith, CCP chair, facilitated the meeting. Also attending were CCP members Tom Gose, Aaron Smith, Sarah Leak, and Robin Segner. A possible returning CCP member, Sophia Alexander, was introduced. The online January 2023 CCP meeting is called to order. The December 2022 meeting minutes were read and approved. There was no December Behavioral Health Advisory Board meeting, so this was not reported on. We reviewed the Saturday, December 17th, 2022 Santa pictures the CCP provided. Robin said this event did not go well and that we had trouble with the pictures. She said only one group of people was there for the pictures, and this group almost left. Brent said the event was okay, but that we didn't advertise well. Brent also said that next year we should reach out sooner and do a better job. Robin said that everybody should advertise, and we should advertise at Frontier Behavioral Health. Sophia said that she emailed people about the event, and Sarah said we didn't advertise enough and should advertise earlier. Kellen said the event went well, but we had technical issues. Robin asked if Frontier Behavioral Health still has an events calendar if the CCP can advertise on it. Brent said the same place, Quality Inn, would be a good place to hold the event, and that we should do it after Thanksgiving, but closer to Thanksgiving. Robin said that when we did the pictures, the time was too late. Sarah said that the 2nd of December would be a good time to do the pictures, that we should do the event from 10 a.m. to 2 p.m. during the daylight. Gail said that having the date set will help, and also said to do it during the daylight. We didn't discuss the Evergreen Club 5K, a 5K the Evergreen Club does, and the Jaunt in June, a walking event the CCB does. Kalen said that when Evergreen Club does the next 5K, they should get flyers out. Sarah said we should get out Jaunt in June flyers. Sophia said the CCB should send out emails about the events it does. Brent mentioned the next Jaunt in June is planned for Tuesday, June 6, 2023. Sarah said that she thinks the flyer for the jaunts is ready to go. Sarah also said that the CCP needs to know the cost of the coming jaunt and if we have enough money left over for the Santa pictures. It was mentioned that we can buy water, treats, granola bars, and trail mix for the jaunt. We can also get coolers and sugar-free stuff. We need tables for the groups that attend. It was suggested we ask Jeff Thomas if he can attend, and we asked Carlos Zavalli if she can help with advertising. Gail gave the OBHA update. She said the OBHA has been in operation over 3 months and is starting to hold monthly forums. These forums allow people to say what is and what's not going well with the system. Gail said that she can send us a flyer about this. Every month on the second Wednesday, there will be an online forum. Gail also said that she's been approved to be a Behavioral Health Advisory Board member. Gail mentioned that his title is that he's a liaison to the BHASO. Sophia Alexander was then proved to be a CCP member. It was noted that Sophia's email is runningstart0821@gmail.com. We discussed the CCP Facebook page. Robin said that she will send invites and the page is open to the public. Robin also said that she would like to hear from people from the Spokane area about events or any comments they might have. Brent asked if anyone has a list of groups that used to attend the jaunt in June. Some groups that were mentioned were Peer Spokane, Fire and Human Services, NAMI, and Recovery Cafe. Brent then asked at the next CCP meeting, everyone bring the name of one agency to contact to possibly attend the next jaunt. Also, it was noted that Gail's phone is 509-655-2839, and Kayla's number is 509-477-4515 or 509-435-8885. Next CCB meeting will be held online on Monday, February 13, 2023, from noon to 1 p.m. Meeting was adjourned. And I have here the CCP minutes from February. At this meeting, our guests were Kalen Roy, liaison to the BHASO and CCP, and Gail Colwell, the Office of Behavioral Advocacy. Brent Smith, CCP Chair, facilitated the meeting. Also attending were CCP members Tom Goes, Aaron Smith, Sarah Leak, Robin Stegner, and Sophia Alexander. The online February 2023 CCP meeting was called to order. The January 2023 CCP minutes were read and approved. Gail then mentioned that you can send out Zoom invites for the online Office of Behavioral Health Advocacy for a meeting. We discussed the January Behavioral Health Advisory Board meeting. This meeting was known that Gail is now a Behavioral Health Advisory Board member, and that BH Ombuds is now the Office of Behavioral Advocacy. There was a presentation by Gail about the monthly Behavioral Health Advocacy Forum. The forum tries to find out what works and what doesn't work in the system. There was a presentation about the 2023 Quarter 3 Crisis Data Dashboard by Katie Rice. She said that all the metrics are in line from the previous quarter, and there's been a declining crisis. People have been calling 988 instead of the hotline. There have been about 3,000 regional crisis calls. There was an administrative update by Justin Johnson. He said that there is a community services department change. Just as the interim director, Kathleen Girola, has left. The department is working on transitioning the Department of Housing to Community Affairs. George Dahl is now Community Services Department Administrator. There was a SB-SBIRT update by Katie Rice. He said everything has been successful. The goal has been to screen kids and refer them to treatment. There was an AOT or Assisted Outpatient Treatment and MRSS, Global Response Stabilization Service update by Justin Johnson. He said that the AOT has been in effect 2 years and was enhanced last year. There is more long-term engagement with outpatient providers. Mental health and substance use disorder providers are now allowed to make referrals to AOT. It looks like King, Pierce, and other counties have money for this. Spokane County may have money for this in the future. Justin said that the state is working on funding for MRSS with Medicaid and non-Medicaid. There may be funding for crises last from 72 hours to 14 weeks. Funding may be there for child and family providers. It was noted that MRSS has received a grant from SAMHSA. Kim Taylor was elected Behavioral Health Advisory Board Chair, and Andrew Van Winkle was elected Vice Chair. The CCP discussed the coming jaunt in June, a walk-in event the CCP does. The panel decided to send out an email about the date of the jaunt. Brent said that we have permission from Jeff Thomas to do the jaunt. The panel mentioned that some groups that might attend the jaunt. These are Passion Addiction Treatment, Community Mind Enterprises, Hands Across the Falls, NAMI, and the WSU EWU nursing students at River Point. Robin said that the CCP needs a link so people can look at the flyer for the jaunt. Brent said that we need to confirm we have tables and canopies for the jaunt. It was mentioned that Frontier Behavioral Health can possibly provide 7 tables. Sophia mentioned that she can possibly provide 2 tables, that we can make 81 copies of the jaunt flyer for free at the library. Kaylin said the budget for the jaunt this year is $300. Brent said that we should get out the flyer soon. Ron said we should include a map of the jaunt's walk route in the flyer. Brent said that we do not need a permit to do the jaunt walk as long as we stay on the sidewalk and follow the lights, etc. The date of the jaunt is Tuesday, June 6, 2023, from 11 a.m. to 1:30 p.m. The contact info is rsegner at yahoo.com or brentsmith232@comcast.net. Next CCP meeting will be held online on Monday, March 13th from noon to 1 p.m. Meeting was adjourned. That's my minutes.
Thank you, Tom. Folks, any questions for Tom? What was the time of the jaunt again, Tom? I heard Tuesday, June 6th, but what was the time again?
Tuesday, June 6th, 2023, from 11 a.m. to 1:30 p.m. That's tentative.
11 to 1:30. Thank you.
That's tentative, yeah, I think.
Okay,
Yeah.
okay, got it. Folks, any other questions for Tom? Okay, thank you, Tom. How
You're
about
welcome.
board comments? I attended, this is Kim, I attended recently a training at Sacred Heart, and the topic of that was mental health advanced directives. So I got honestly really excited about how important these are. So I'm just going to sort of put out there, I think this is an important area that the public, and I say the public generically, but I think that we, whether that be the board, whether that be working with the Ombuds office, whether that be working with NAMI, whether that be working with the other agencies, but I think this is certainly an initiative, for lack of a better phrase, that I think we would do well to take on. So short version being, when people are at sort of their best selves, that would be the time to set up a mental health advanced directive. Because at the time of crises, and it basically sort of dictates what's important to them and their values, because at the time of crisis, that's not going to be the time that would be taken into account or taken seriously. But it will help people direct sort of the care they want to have or don't want to have. So if anyone is maybe willing to have a further discussion with me about how we, and I'm using the we very generically and very broadly, could maybe get involved to help advance this particular issue in our community, please let me know.
Kim.
Yeah.
I'm so glad you brought that up. And I'm happy to hear that the hospital is doing that training. I knew that the hospital associations were doing these trainings. I've been fortunate to be on a statewide committee that we were trying to develop a wider use of mental health advanced directives. I also do a short training on what they are and how they can be used for the end user. And we are trying to make that a little bit more available. Our group has actually had asked the state legislature to designate some work groups. One work group would be to be able to provide these toolkits that could be used for many different reasons, any different venue. Unfortunately, the bill didn't make it to Ways and Means due to a misunderstanding. It was House bill or Senate bill, I can't remember which now, 5660, but it didn't survive. So we're still trying to get that worked out, but I'm happy to talk with anybody as well about a mental health advanced directive and how important they are. And you're right, it's when you are in a better frame of mind is when you create those. Where they get stored, how do they get used, and do they get used the right way once you are inpatient is a part of the discussion as well. So
Sure.
thanks for bringing that. I'm so glad you did that. I wish I would have known that there was a training like that. And so I'm happy to talk with you more offline about it.
Okay, that sounds wonderful. Any other board comments?
But I think the rest of the board could support it too.
Yeah, exactly. All right. How about any public comments?
I would be interested in helping you take that on, Kim. I just
Okay,
know that,
sounds good. Thanks, Shane.
that through the providers, you can talk to Liz. Liz would probably be a great resource to talk to about this as well.
Got it.
With
Okay.
CHPW.
Any additional comments, board or public? All right, perfect. Thank you, everyone. Appreciate the questions today and the discussion. I'm seeing a message here. Okay, so we will meet again Monday, May 22nd, 2023 at 3 o'clock. And in the interim, if anyone is aware of any community events or other things of importance, please feel free to send it out to us via email, or maybe send to Nancy, who could forward to us.
Well, one last thing, May is Mental Health Awareness Month. And so I know that there's a number of activities going out around the state. I'm not sure what's happening regionally, but I'm in our region, but I think that would be good information to share as we come across it.
Perfect. All right, everyone. Have a wonderful afternoon. Looks like the sun is shining at least a little bit at the moment. Take advantage of that. Goodbye.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you. Have a good day.